This is Health Call Online, the place for extended versions of interviews you hear on our weekly radio broadcast, the Health Call Radio Hour, now in national syndication and heard in more stations around the country. We're going to sit down today with a good friend of the program. He is Gregg Russell, the clinical nutritionist, pharmacist, and founder of Fort Wayne Custom RX. Our focus is men's health issues. And Gregg, glad to have you here to talk about, my gosh, we're going to cover testosterone, prostate issues, zinc, some other supplements that may help men. And let's just kick things off here with what you think is probably the most unknown secret about managing men's health as we age.
Yeah, so, great to be here again, Lee. We're going to talk about guys for once. We usually spend a lot of time talking about women, but we're going to talk about guys. So this is a guys show this week, and we'll talk about our health issues. Guys are pretty good at, kind of pushing off their health, except if I say your sexuality or your ability, your libido is going downhill, then that's when they go in to see the doctor, and that's certainly been reflected in the pharmaceutical market over the years. When the drugs like Viagra came out, they became blockbuster sellers, and all of a sudden, who knew that ED was such an issue, right? Mm-hmm. So, but today we're going to talk about one of the causes of ED. We're going to talk a little bit about testosterone, and hey, guess what? All of us guys make it. So, we kind of need it just like women need estrogen.
Yeah, and we make less and less of it as we age. So starting about 30 or so, you start producing less and less each year.
Yes, absolutely. And, it's kind of like after about age 30 to 40, we start losing about 1 to 1.5% estimate of our testosterone production. Of course, that's made in the testicles for men. And as we age, it's just naturally going down. And aging is certainly the number one risk factor for that. But there's also other factors such as environmental in our health. As we start talking about blood sugar control and insulin, cortisol and stress, all those have a major impact. And probably it's one of the most, I think doctors are especially urologists, are onto this pretty much now. But I can tell you 20 years ago, there weren't as many men using testosterone as there is today. They estimate that there's somewhere about 500,000 men per year of new onset, what we lovingly call andropause, the male version of menopause. Yeah. And so it does impact men's health.
Well, let's talk about that. Outside of the sexual libido impact and other things, how does testosterone affect my metabolic health? Let's start there.
Oh, that's huge. There's been ongoing controversies in the literature about, what level you need for your testosterone to be maximal or optimal. And we'll talk about that in a few moments. But, there's definitely, we now know that men that have low testosterone are going to have metabolic issues. Their cholesterol is not going to be under control. There's definitely an association with diabetes and blood sugar. So we know, for example, patients that have diabetes tend to have low testosterone, and low testosterone has a relationship to increasing amount. Low testosterone increases the risk of diabetes. So there's that relationship, that correlation that goes on. Hard to say it's causative because there's many things that cause diabetes, but we now know that, I have talked in women's health that the main reason we have hormones is brain, bone, and heart besides reproduction. Same thing is true for men. We know testosterone. There's numerous studies that show that men with low testosterone are higher risk for, having osteoporosis, for example, less. Mm-hmm. And of course, their muscles, which having lean muscle strength also improves our bone strength. So there's obvious relationship there. Men that have low testosterone tend to have higher cholesterol. And of course, testosterone, we know it's important for our muscles, right? What's the mm-hmm. biggest muscle in the body? The heart. Yeah. So, that just stands to reason. So, but, as we age and we start having low testosterone, what are some of the signs and symptoms that we're going to see? Obviously, we talked about low libido, loss of body hair, such as armpits or the pubic hair areas. Testicles will start atrophying, which, that's not something that most guys are going to go out and measure and see unless it's extreme. But one thing that men don't think about is sometimes we'll get hot flashes as our testosterone levels go down. And that's because there is a conversion of testosterone to estrogen. But I think the number one reason that men probably need testosterone more than anything is they'll start feeling fatigued. And that the guy that says, I always go out and play golf 2 or 3 nights a week, now all of a sudden they come home from work and they're just tired. They just go to the couch. And I think that's one of the largest impacts of being low on testosterone.
Man, and that lack of activity begins that downward cycle, that spiral, right? So you don't feel well, you don't have the energy you used to have, and so you're less active, which then increases the risk that you're going to get into diabetes and weight gain and all of those things. So, yeah, it's a spiral that can really pull you down. I want to bounce back to something else, and that is the emotional, the mental health link to testosterone. I've seen study after study that says men with lower testosterone levels have higher levels of anxiety and depression. Can you support that?
Absolutely. And, we know testosterone is involved in many of the brain chemicals production. But, again, if you're feeling fatigued all the time, you're going to feel depressed. And then you throw on, we've all been isolated with COVID, last couple of years. So, that was some of the untold effects. That was kind of predictable as we shut down the country, that we'd see some of these health issues starting to light up, because as people became inactive and weren't able to do the activities, they put on weight, and we know that increased obesity plays a role in that, and lowering our testosterone production just by many different mechanisms.
Well, let's talk about that a little bit. So as you gain more body fat, how does that suppress testosterone?
Yeah, so that's really interesting. So fat cells are called adipocytes, and they have an enzyme in them called aromatase. And aromatase has a tendency to break testosterone down into different factors. And one of the ones that we worry about is estradiol, as well as we worry about DHT, which is dihydrotestosterone, the more active component of testosterone. So, which is also the form of testosterone that causes prostate cancers or breast cancer cells to grow. Okay, there's your link there. But when we continue to gain extra weight, we also make a hormone called sex hormone binding globulin. That sucks up, that blocks the free available testosterone in your body. So there's total testosterone. When you go to the doctor, they'll draw and that's the amount of testosterone in your blood. Well, that's a nice number to know, but it's more important to know what's the free testosterone. That's the amount of testosterone that's not in the blood, attached to the blood cells, but that's actually going to go to the receptor and do the work. And sex hormone binding globulin makes less testosterone available to work, or less of the free testosterone to work. So in essence, you might have a good normal testosterone level, but your free testosterone level might still be in the tank, and you still may feel pretty fatigued.
Oh, that's interesting. So let's talk about what we can do about this. Now, just full disclosure, I think I've mentioned it many times on the program. I have been, and for years now, have been using a compounded testosterone cream that you at Fort Wayne Custom RX prepare for me. I find it very simple and easy to use. It's a non-issue for me. Right. But there are other things. So let's talk about how the different forms.
Sure.
One of the things I like about the cream is it's simple, it's easy to apply, it absorbs quickly, it's not greasy. Are there any reasons to use something other than the compounded cream?
Sure. So, yeah, the cream is probably one of the most common ones. The commercial products are available. There are commercial products available. They tend to be gels. They tend to be a little bit more messy, in my opinion. They're a little bit, you're putting 4 or 5 mils of a gel on your body, and you have to put it in certain areas, and it's difficult to apply it. You gotta let it dry, for example, before you put your shirt on. With the creams, we can concentrate and put them in little units, the measurements. So we tend to put them in syringes so that people can just rub it on, and it rubs in real easy. So that's probably one of the most common forms. It would really be nice if we could make a pill and swallow it, but what happens is when you take the testosterone orally and swallow it, it goes through the liver and it gets transformed down to other chemicals, which are also linked to cancer. So we like to typically bypass the liver by using a cream, an injection, or sometimes we'll even do what we call a sublingual troche. I'm not a real big fan of sublingual troches, but there's a dosage form for everybody, right? So if somebody has maybe coordination issues, can't use the cream, might be a troche, might be easier. But the other thing we do is we make a subcutaneous injection by taking the testosterone, putting it in a special vehicle to make a amount of a product that you just put a little bit under your skin. It's easier to handle than doing a big muscle injection. And again, these are prescription items, so you have to go see a doctor and they have to do your full evaluation. Testosterone is not for everybody. You have to have a need and you have to have symptoms and you have to have no risk factors. So we don't want to give it to somebody, for example, who's got cancer, prostate cancer, for example.
Well, I'm glad you went to that because there is still fear about testosterone supplementation increasing the risk of prostate cancer. What's the data show? What's the science teach us?
Yeah, so the way I tell people is the link to testosterone and cancer is a little bit of a cloudy one in that, a lot of people early on believe testosterone started cancer off. But the reality is a lot of times cancer is already occurring in your body and nobody knows it. What testosterone can do is it can light the fire and actually reveal the cancer. And so, we have to kind of think of it in that. That's not necessarily a bad thing because if you reveal the cancer and you can treat it early, and I'm not advocating that's why I use testosterone, but it's kind of a different way of thinking about it. And I noticed urologists are a lot more comfortable today using it in men. But obviously, if you have prostate cancer or breast cancer, your doctor is probably not going to prescribe testosterone, and that's probably wise until we know more. Because there's other things we can do to try to help boost our testosterone levels naturally too.
So let's talk about that just a bit.
Okay.
One way you can boost testosterone is exercise. So weight-bearing exercises just sort of automatically boosts testosterone.
Sure.
And I just read a study the other day that said one of the reasons that we may be seeing such a big increase in the number of men who have low testosterone is we're not working on the farm like we used to for generations, right?
Yeah,
We're not using our bodies the same way.
So again, that sex hormone binding globulin resides down there in that adipose tissue around our bellies. So we used to think fat didn't do anything. Well, now we know fat makes all kinds of chemicals, and those chemicals may not necessarily be good for all this research about brown fat and white fat and all that it's fascinating because as we learn more about fat, there's obviously better forms of fat, and we're made to have these different forms of fats. But we have to keep it all under control. And one of the counter effects to obesity, of course, is movement. So I hate that word exercise. I call it movement. We need to move because if we're not moving, we're going to be storing instead of burning. And that fat reservoir, for many reasons that we talked about earlier, causes some leptin resistance. Leptin is another hormone that seems to be involved in testosterone production. So, these things that we don't always like to do really is for our better health.
Yeah. So as it comes to the cancer risk, I think we've discussed that, and certainly something you need to discuss with your urologist or your family physician. Mm-hmm. But also, is there a concern about prostate enlargement associated with testosterone supplementation?
There can be. And so a lot of men that whether they're on or off testosterone, we do recommend a lot of prostate supplements. They typically contain things like saw palmetto in them. Stinging nettles is another, and then pygeum is a third. So there's a product that I have that we've had formulated for us by the orthomolecular company that has these things. They all work different mechanisms, but they're as men age, our prostate is naturally going to increase. It's naturally going to increase. And so these are trying to slow that down. Of course, a enlarged prostate is going to cause other problems. First of all, a lot of times the PSA will go up, so that makes everybody kind of concerned about cancer. Well, the truth of the matter is, as many men, if we lived long enough, we would all get prostate cancer at some point. Most of us won't die of prostate cancer, so our prostates will enlarge naturally. But then it starts impacting things such as urinary flow. So things like Pygium help with the urinary flow also. So, then the guy gets up in the middle of the night, tries to go to the bathroom, can't go to the bathroom. Then he has difficulty going back to bed at night. And so this vicious cycle starts, right?
And sleep is so tightly regulated or associated with testosterone production. When you interrupt good sleep, that also interrupts testosterone production. So that's, again, that whole cycle thing happens. Tell me about the role of zinc. I often hear zinc supplementation being recommended for men. Is that something I should think about?
Yeah, so zinc is a very interesting chemical, and that it's a mineral. We've talked about it numerous times as we talked about viruses and replicating, and why zinc plays a role here. But zinc is important, and it helps make luteinizing hormone and follicle stimulating hormone, which are important. We think about those for females because it's involved in ovulation and conception. But it's also important for men because at this pulsatile dose of these two hormones, the luteinizing hormone and makes semen, and I'm sorry, I said that wrong. Makes testosterone, and the follicle stimulating hormone helps make sperm. So they're important for making our male hormones too. So zinc, if people have a zinc deficiency, the zinc is important because it triggers the enzyme process that allows the brain to make those chemicals.
I gotcha. So zinc is, and that's something that we should be getting from our diets. But if you're not eating a lot of green leafy vegetables and, a good healthy diet, then, there's a good chance that you're going to be zinc deficient.
A lot of the prostate formulas will also have some of those in them, in those combination products.
So what's your recommendation when somebody comes and talks with you about testosterone supplementation? Where do you start to find out and have that test done? Is that something I need to go to a lab and through my doctor's office? How do I know what my levels are?
Right. So it's very routine now for doctors to check levels. There is a questionnaire called the ADAM questionnaire, which stands for, I always have to look it up, the Aging Androgen Deficiency in Males. And this is a real easy question. It's 10 questions. And if you answer 3 yes answers, then that's a screening that you should talk to your urologist or your family physician. If you there's a couple questions on there specific to one is libido. Do you have a decrease in libido, sex drive? And if you answer yes to that one, or to number 7, are your erections less strong, which is going to naturally happen too for men, then those are warning signs to start having that conversation with the doctor for him to try to evaluate whether or not testosterone might be an appropriate treatment for you.
How soon will I begin to notice some effects if I start a supplementation program?
Yeah. So typically we tell men 2 to 3 months, and we are almost, always going to start people low. And in fact, we shouldn't expect that we're going to get an overnight result. Because the thing about testosterone, you don't want to give somebody too much. You want to start low. You can't. It's more difficult to back them back down. And the reason for that is we do know that giving men too much testosterone can do 2 things. One is, cause a PSA to really rise quickly, and that's going to be alarm bells for the doctor. The other thing that it can do is that it allows the bone marrow to make more red blood cells, and red blood cells, of course, make blood. So we know if we give somebody too much testosterone, we can make too much red blood cells for the blood, which then makes the blood thicker. Well, then there's your relationship to giving men too much testosterone causing a heart attack or a stroke. So those are things that your doctors are going to always measure these things consistently if you're on testosterone, because they don't want it to get out of control.
Is there a time frame? Will I stop taking testosterone when I'm in my 80s, 90s? Should it continue?
Again, more controversy to that, but they've shown that men that use testosterone, and I think it's going to I kind of think of it similarly to women that are going through menopause. If you get people on it earlier, you see better gains. But they've shown that even elderly men, when they're placed on testosterone, their muscles tone becomes better. Their muscle, their body composure is better than it would be, and they feel more energetic. So my deep belief or opinion is, as long as you're being monitored, you can stay on testosterone the rest of your life. But it's going to also depend on other risk factors, and that's going to be obviously something the patient will have to be in close connection with their doctor over.
Well, I've enjoyed talking with you about this, Gregg. It's something I think a lot of guys have questions about, and it's good to hear from somebody who follows it as closely as you do. I appreciate your time. Thanks so much.
Well, you're very welcome. Have a great day.